name's Helena. I'm the communication specialist for speech and language therapy, working with adults with longer term conditions. So that's working in the acute setting, on the stroke unit, and also in the community across Wales and Wire Coast. So I wanted to become an advocate for people with communication difficulties. Communication is so central to our entire identity, and to have that lost is something that I wanted to be able to support people through. And there's also the side of swallowing, to be able to support people in those last stages of life as the swallowing deteriorates, and give that support to the family and caregivers as well. You're constantly learning, you're always taking on new challenges, and that's something that I like. You're constantly pushing yourself to do something different and take on a new role. And also no 2 days are the same. There's constant variety, no two patients are ever the same, and no two situations are ever the same. So there's just ever evolving role. You never know what you're going to do the next day when you come into work. I think speech and language therapy, we see the whole person, and that's central to us, that whole person. So we're not just looking at the communication and at the swallowing, but how's that affecting being able to access work, being able to communicate with your family, being able to access your GP services. And I think that way of thinking goes beyond the person-centred that we hear so often talked about in the NHS, and is actually targeting everything that we do about how is this going to impact you functionally on a day-to-day basis. What impact will that have on your life and on your family and those caregivers around you? So as a whole team, we are leading on the change of the IDSI change, which is the International Dysphagia Diet Standardisation Initiative. And what that means basically is that all of our descriptors for diet and fluids, for dysphagia, texture modified diet and fluids, are changing. And that's to bring us in line with an international framework, and it's to increase patient safety. So our team is committed to bringing that out, rolling it across the community and the acute setting within the next 12 months. Another change would be the changes to our motor neuron disease pathway. We're hoping to facilitate faster access to speech and language therapy for people who have been diagnosed with motor neuron disease, training the therapists so that we can offer the best quality therapy, and also adapting our resources so that we've got access to alternative augmentative communication. So MND is a degenerative condition, and people often degenerate quite rapidly. And often what we are seeing is that people are not getting referred to speech and language therapy until they've already started to present with symptoms. And at that point, we are no longer able to offer voice banking facilities so that people can use their own voice onto their communication aids, or message banking facilities, so people may not be able to have their whole voice on the machine, but they can say certain messages such as family names, names to their pets, and different phrases and jokes, things that they would normally say, so they've got that communication interaction with their family. So speech and language therapists use their knowledge and skills to promote independence for the person, to facilitate decision making about end-of-life decisions and life choices. And I would like that wider role of the speech and language therapist to be more recognised. I think that we are a link to a lot of other services. So if somebody is unable to swallow, that may then make them more poorly, more underweight, and they cannot then access those other services. If someone is unable to communicate their needs, they cannot access their community, they cannot access other therapy services because they may not be able to understand or to communicate their needs. And it is that we are not just looking at the swallowing specifically or communication specifically, but how that has an impact on that person and their family and their community.